horrible.
Mm-hmm.
And so we're always on the lookout for
names
Weird.
we don't know.
Yeah.
So a no good Nick.
A no good Nick.
No good.
We were sure that we spotted a no good Nick in the waiting room once. It was my brother-in-law.
Well, you are my definition of. What's the term? Where did no good Nick come from? The term.
I could say it, but
I knew you'd know it.
I'll defer
To Ellie?
to Roxy and Megan, who'll be old enough to remember the Cold War.
No good, Nick. I'm thinking Sputnik.
Yeah, that's exactly what it was.
Oh, good
Really?
guess.
You
Good
added
guess.
Nick to the end of anything. Beatnik, Sputnik,
No good, Nick.
no good Nick. It gave them a taint of communism.
Wow.
Yeah.
Interesting.
Roxy,
Is it-
you would be under suspicion with your last name.
That is a great factoid. Yeah.
Did we capture that on our simulcast?
Yes, we are live.
Yeah.
No good Nick. We're learning about no good Nicks and beatniks. Sean, do you know what a beatnik is?
Beatnik. I would assume like that beatnik. I think it's like not a good person, kind of like a no good Nick, but that would be what I would assume if someone was like, that guy's a kind of a beatnik, kind of a deadbeat.
Kind of a deadbeat. Ellie, do you know what a beatnik is?
Like somebody in the 60s who did kind of edgy poetry and art.
Yeah, that's
Thanks.
good. Yeah. Beatniks are like considered the precursors to, say, hippies, to the counterculture. They were the 1950s counterculture. Roxy, can you name a beatnik writer?
I can't, you know what? I have his name. Was Timothy Leary considered a beatnik writer?
Jack Kerouac, we'll say.
Jack Kerouac.
Jack
I would
Kerouac.
have remembered that at 2 a.m.
Roxy, you seem to do a lot of thinking like that early in the morning.
It's terrible.
Hello, everyone. Good evening. Good evening. Welcome, everyone, to Generation 9/11. I'm Sean Hall, the Director of Programming with the Veterans Breakfast Club. Happy to have you all join us for this very important conversation tonight. But I of course, want to say hello to my wing persons, Todd DiPastino. Todd, how are you tonight?
I'm doing very well, and it's so great to see Roxy with us. Last time I saw Roxy, we were in Vietnam. And Roxy, Chad Riddle is with us too here. I don't know if you see him on the screen. And Fred, this is like a reunion of all of us who went on the Vietnam trip last year. Our last hurrah, I told Roxy it was the last time I had any fun.
Hi, Fred. Hi, Roxy.
Hey, how's it going?
The Roxy fan club. My goodness.
It's a great room to walk into, Roxy. If you can walk in and know everybody, that's kind of wonderful. Ellie, how are you?
Where everybody knows your name.
Yeah, everybody does. Ellie, we don't ever spend any time talking to you. We just kind of see you in the background, and you're the wizard who makes this all possible. I'm going to ask you to tell me a little bit about the scuttlebutt of this past week.
Oh, the scuttlebutt of this past week. You're testing my memory.
Family.
Only the week ahead. Yes. Our scuttlebutt episode this week is about growing up in a military family. And we talked with two people who grew up in military families, one a veteran, one not a veteran. And they had some great stories of what it was like and how it's a bit different than growing up in a civilian family, but how it really has impacted their life and they wouldn't trade it for anything.
It was a really great conversation. Ryan All and Jessica Darcy. Jessica, who I worked with in my previous work, I always kind of knew that she was a military brat, but her and I never really got the chance to sit down and really discuss that, really dive into it. And it was so interesting to watch her and Ryan connect on the scuttlebutt because they'd never met each other before, but had this bond of being growing up in a military family. And it was out of nowhere, suddenly they just spoke the same language. It made my job easy. All I had to do was ask some questions, but boy, it was so interesting to hear about that and understand more about what it was like to grow up and live all over the place, all over the world, gain all this experience. But we also asked them some tough questions about, did they resent their parents as they grew up? They go through all this like, yeah, great, I get to have all these experience. But Jessica made a really interesting comment about the fact that she was really mad at her parents that she didn't get to have a Furby because Furbies had recorders in them, and you couldn't have a recorder on a military base for security reasons. So she mentioned how mad she was at her parents because that's all she wanted was a Furby. But we did that conversation because this is Month of the Military Child. And I also thought it was interesting too, that I thought that military brat was kind of like a bad term. And I ended up Googling that just to see like, what, am I supposed to call people military brats? Is that a bad thing? And really, I think it's such a term of endearment. And even Jessica mentioned it in the podcast. She's like, I was a Navy brat. Anybody that I meet new, I say, yeah, I'm a Navy brat. And like, that was something that it's a badge of pride that they really held. So you can check out the Scuttlebutt anytime, anywhere you get a podcast. You can check it out on our website, veteransbreakfastclub.org. Check it out on YouTube. I say that's the best place to watch it because Ellie just crushes it out of the park every week with her editing. But also tonight, we're going to honor the other thing that happens here in the month of April, which is Sexual Assault Awareness Month. And this past Tuesday, I was joined by Dr. Korchynsky, Timothy Jones, and Ryan All, and we dove into some of the terms about military sexual trauma, about MST, some of the recent headlines as this kind of exploded in the past couple of years into the civilian world with the murder of Vanessa Guillen. There was a civilian inquiry in Fort Hood. 14 members, leaders there were removed. It became a kind of a flashpoint and the I Am Vanessa Guillen Act. So a lot of things have been coming to light over the past year. And we thought, we should have this conversation on the Scuttlebutt. But since it's also, we have this platform with Generation 9/11, I invited Dr. Korchynsky and her colleague, Dr. Doherty, on to kind of talk about this topic and give us some insights and, understanding about kind of what's going on in this sphere. So I really appreciate and I'm very honored by your presence here today, Dr. Korchynsky, Dr. Doherty. And a little bit later, we're going to get to Megan Ayers. Thank you so much for joining us to talk about your Our Sisters Keeper movement, a walk that you have planned later on this month. We'll get to that later. But Dr. Korchynsky, I mentioned this before we started recording that on the Scuttlebutt, we kind of hit the ground running. We have about an hour. We want to like get all the information we can, and then we kind of exit stage right. But we didn't get the chance to really dive into your past because of that time constraint. So I'm interested to ask you what got you into working with veterans who are survivors of MST.
So actually, being a clinical psychologist is a second career for me. And as I finished graduate school and I had finished my internship at the VA, and this was just when military sexual trauma was getting off the ground nationally. And a position came over for the military sexual trauma coordinator. And out of graduate school, my interests at the time were in trauma and in women's health. And this position came open, and I thought, well, I could never have dreamed of this dovetailing for me this way, but it did. And so that my interest in trauma expanded to working with men and women who've experienced sexual assault. And I never thought that I could be so fortunate to land in a career like this that has been just nothing but rewarding. And I feel so privileged and honored to work with the veterans that I do, and humbled that they put trust in me for something as difficult as sexual trauma. So it's been—
Trust is a big thing. Trust, like as we talked with Timothy Jones, who's a survivor on our podcast, he said he lost trust in everything. And for someone to take that step and come into the VA and ask for help, finding someone like you to trust and help them, lead them sort of out of the dark from the end of their rope, that's a big step.
It's huge. And as we were talking, we know that there are lots of things that get disrupted with trauma, like trust, like safety, like self-esteem. And we kind of know that coming in, that individuals that have experienced this kind of trauma come in with these areas of their life that have become so disrupted. And when they get disrupted, other things get disrupted in their lives. And so you kind of know that coming into this work, and the work really becomes helping somebody through all those disruptions and be able to reclaim their lives and get back into the life that they want.
Do you need to have a tough skin to work as a clinical psychologist at the VA, clinical psychiatrist?
Psychologist. I probably thought that in the beginning, but the more I did, I really saw myself as just kind of the holder of these experiences for people. And, some people say, even some of my patients say, how can you do this every day? How can you listen to this every day? And I say, you're doing the real work. You're doing the heavy lifting. I'm the guide here, but you're doing the heavy lifting. I have such an appreciation for how difficult trauma work is. If it was easy, everybody would do it. They wouldn't need a psychologist, but it's difficult. And so I have great respect for people who make the decision to engage in treatment and do the work. It is not easy. And I am just amazed when people just really stick with it and get to the other side and, like I said, reclaim their lives. And
you're not a veteran, correct?
That's correct.
And so what led you to working with veterans specifically?
So my internship out of graduate school was with VA Pittsburgh. And the VA is just a great place to work. And working with veterans, I mean, veterans experience many different kinds of trauma. This is kind of a unique type of trauma, sexual trauma, but my interest had been in trauma, and veterans are oftentimes a traumatized population, and this is kind of a subset of that group.
It's important that you say the word trauma, because I kind of thought about this just now, in the sense that at the beginning of the scuttlebutt, I wanted to make sure to offer a trigger warning that if anyone is listening in, watching tonight, watches the scuttlebutt, and may hear some things that are difficult, we just want to put up there that if you need to talk to somebody, the Veterans Crisis Hotline is always available, and the number there is 1-800-273-8255. I think we can put that in the chat. That's 1-800-273-8255. We also say that you could talk to a friend, you could talk to a healthcare professional. We obviously want to open up to chat and comments and questions as we get through the program tonight. So if you'd be so kind as to just put those into the chat, we would like to ask Dr. Korchynsky or Dr. Doherty any of those questions that you may have. Dr. Korchynsky, I know that you sort of prepared something for tonight, so I kind of want to hand the stage off to you if you'd like.
Yeah, so I just wanted to talk kind of generally about what military sexual trauma is. And given that we are in the month of April, Sexual Assault Awareness Month, and military sexual trauma is really a VA term. It came out of public law, out of the scandals that happened really in the 90s with Tailhook and Aberdeen Proving Grounds. And sexual assault is really any kind of activity, sexual activity, where an individual was forced or coerced to do something of a sexual nature that was against their will. They were either coerced or pressured, forced. They may have been unable to give consent due to intoxication or some kind of cognitive impairment. It's a big umbrella term. It can include sexual assault, grabbing, groping, fondling, cornering. Lots of behaviors are on that spectrum. And sexual harassment, those are verbal remarks that are threatening or offensive about a person's body, gender, sexual activities. It can also include physical activities, such as threatening and unwelcome sexual advances. So when we think about military sexual trauma, I think about a large spectrum of behaviors And it was intentionally left that way to be able to include as many of these unwanted experiences as possible. So when VA started to address this issue back in the late 90s, early 2000s, we started to screen all our veterans and asking about these experiences. And so we've been doing this for over 20 years now and rolling the data together. And what we're finding is that of our veteran population, 1 in 3 women and 1 in 50 men have told their healthcare providers that they had one of these experiences on this very big spectrum. And that's quite a significant number when you think about it.
Yeah, because not to interrupt you, Dr. Korchynsky, but in making even that number even more specific, from 2019 alone, there were 7,825 reports of sexual assault involving service members as either victims or the subjects of criminal investigations. Also, 1,021 formal complaints of sexual harassment were received by the military services in fiscal year 2019, a 10% increase in complaints from 2018. And we'll get a little later, we'll get into some of the more recent headlines of things that are still happening.
And so, not surprising when individuals have these kinds of experiences, all sorts of difficulties can arise. And of course, the one that people think of the most is post-traumatic stress disorder. That's probably the most common mental health diagnosis following a trauma. And certainly it is the most common following sexual trauma. But we also know that individuals can have difficulties with depression, anxiety, substance use, self-harm, eating disorders. And then there are things that people may experience that they don't necessarily think of as a mental health problem, but they may wonder why they can't keep a job or why they can't maintain a healthy relationship, why they can't stop abusing drugs or alcohol. And so there could be this whole host of problems that develop following a trauma. And so on my side at the VA, and I'm always thinking treatment and recovery, and I think important to talk about some of the kind of the complicating factors to recovery or some of the barriers. And certainly when I think about what veterans have told me has kept them from treatment for years and years is often shame, guilt, avoidance. But we also know that, individuals, when you think about when an individual enters the military at a pretty young age, oftentimes, and they have a limited repertoire of coping skills. And so they may not really know how to cope with or process a trauma. One of the things that we have talked about before is, and really kind of what I wanted to really highlight on today's program, are how some of the messaging or the military ethos that is so functional in the military can really be harmful to service members who experience a trauma or sexual trauma. So when we think about some of the messaging that we want service members to adopt, the importance of being strong and self-sufficient, and that is great, and that's very functional messaging for a service member out in the field. But if somebody experiences a trauma like a sexual assault, they feel, well, I'm supposed to be able to deal with this. I'm supposed to be strong and self-sufficient and just carry on. And oftentimes that's part of the story I hear from men and women who've been sexually assaulted. And when we are processing their assault, they say, well, what happened next? And they said, I went back to my job. And this is where it becomes harmful, because they're not stopping and pausing and saying, wow, what just happened to me? This is out of the ordinary, to say the least. Mm-hmm. So, and when people, oftentimes when we think about people who join the military, and maybe if individuals are coming out of chaotic homes, or even if they're not coming out of chaotic homes and they're looking to be part of something larger, this kind of family, a brotherhood, a sisterhood. And that actually makes this whole notion of victimization even more difficult to comprehend, that this was something that was perpetrated by somebody that was supposed to have my back. And additionally, when we think about how service members are trained, and they are trained to suppress physical needs, emotional needs, right? You don't want to have a breakdown in the field, or you don't want to kind of address an emotional need when you're on the battlefield. So they're taught to suppress these needs. But this is actually a very harmful thing when somebody is facing a sexual assault. We don't want them to suppress those feelings or to suppress the physical consequences of an assault. So those are some of the things that can make seeking treatment even more difficult. We also know that an additional complicated factor is individuals can have pre-military traumas. So childhood sexual abuse or physical abuse or emotional abuse. We know that trauma has a cumulative effect. And so that kind of pre-military trauma kind of primes the pump, makes individuals even more vulnerable to something like post-traumatic stress disorder if they're assaulted in the military. And I would be remiss, and certainly since we have Dr. Doherty here, there's a concurrent exposure to another kind of trauma if you're in a combat zone, if you're in a combat theater. And so there's this risk of a concurrent trauma, of sexual trauma and combat trauma. So these are some of the complicating factors when we think about individuals who've been sexually assaulted in the military, and we want them to seek treatment, we want them to get help. And I think recognizing some of these barriers and some of these really unique circumstances of a sexual assault in the military versus sexual assault in the civilian world. And I'll just pause there just to see if anybody has any questions or comments.
Thank you. I do want to define a term. And we talked about this a bit on the Scuttlebutt that'll be coming out this coming Monday. This idea of survivor versus victim. And that at first I thought victim was the correct term, and was told, no, actually survivor is the correct term to use for someone who survives military sexual trauma, survives MST or sexual harassment or assault in the military. Can you explain to me what that difference is? Is victim still able to be used?
So I personally don't think victim is a bad word. And I will often use that word because it is accurate. At the time of a trauma, there was a single victim and a single perpetrator. And I think using that word, identifying an individual who experienced sexual trauma as a victim, is accurate because at that moment they were victimized. And I think that helps. I think it helps individuals to more clearly delineate who is being victimized and who is the perpetrator. Because oftentimes one of the drivers of guilt and self-blame is an individual thinking, well, this was somehow my fault. I shouldn't have gone with this person, or I shouldn't have been drinking, or I should have seen it coming. There's this self-blame. And I think that using the terminology of victim in that context helps individuals see, well, wait a second, there was a single perpetrator here and a single victim. And also reinforcing this idea that because an individual was victimized once or victimized at that moment, does not mean that they're always a victim. And in fact, when people recover, I think a lot of times people see themselves as, I'm not being victimized by this trauma anymore. I am surviving. And as Timothy talked about, he's thriving. And so I think the use of the word victim has a place. And I think it has a very useful place.
Timothy talked a lot about how it's consistent work. It's not, I went to the VA and now I'm better and I can continue on with my life. He's mentioned, even last night or this morning, I had to wake up and I had to go through the protocol of, what I need to do to set myself up for success in the day. It takes a lot of courage and a lot of willpower to overcome that trauma and work with it as opposed to fight against it or push it aside.
Right. Avoidance. And I always tell patients, I get why people avoid. I get why you don't want to come to an appointment or talk about it or think about it, because it's distressing. And a lot of very strong feelings come up. But one of the things we know about PTSD is avoidance is actually the thing that keeps it going. And you really never get a chance to process the trauma, work through it, if you're always avoiding it. So I understand why people want to avoid, and I try to communicate why it's not a great strategy. And I also tell people, if avoidance was so effective, you and I wouldn't be sitting here today. You wouldn't need me if avoidance really worked.
Mm-hmm. And I want to bring Dr. Doherty into the conversation as well. And hi, Dr. Doherty, how are you doing tonight?
Hi, great, thank you.
Thank you for joining us.
Sure.
And you're a veteran of the
Army? Yes. Yeah. So for a couple of you know me, but most of you don't. I am an Army veteran. I was an active duty Army psychologist for 6 years, including a tour in lovely Mosul, Iraq. And I was in the reserves for 2 years after I got out for personal reasons. Wanting to have a child was not conducive to a deploying again in 6 months schedule. I also had people often wonder, well, how could psychologists want to be in the military? But I'd actually thought about going into the military since I was in high school in some way. And although I'm not an Army brat, I come from a military family. My youngest brother was a Marine who served in Afghanistan. My dad was a Vietnam veteran in the Army. For those Marine historical buffs out there, my maternal grandfather was a Marine who fought at the Battle of Peleliu, which is one of the bloodiest battles in the Pacific in World War II. And my paternal grandfather, who I didn't know, was in the Army in World War I. So we have a pretty extensive service background. I had an Army Health Profession Scholarship that helped me pay for part of graduate school, and then did a military psychology internship as a full officer. And I've served in Korea and Fort Bragg, and as well as Fort Bliss, and then to Iraq, and then back to Fort Bliss. So that's a bit of my story. I kind of got trained in PTSD, OJT, on the job training along the way in the military because of the frequent pace of deployments. And as Dr. Korchynsky mentioned earlier, many of those were multiple trauma survivors. They had childhood trauma, they had military sexual trauma, they had combat trauma. So what people would now call complex trauma was kind of my daily job. I would also just like to point out that military sexual trauma does not necessarily mean that a military member perpetrated the assault. And I think it's important people remember that. And it's not always included in the statistics. So when we talk about the prevalence of military sexual trauma, we get what the services report to us, but that's not always, and not even often, including those military members who were assaulted by civilians potentially off base that may have been handled through the civilian court system.
Wow, I didn't even consider that. Thank you for bringing that up. What years were you in Mosul?
I was actually in Mosul from the Halloween, October 2006. And then I came home on Veterans Day of 2007.
Oh, wow. Okay. And what was it like being a psychiatrist in the Army?
Oh, well, okay. I'm a psychologist also, like Dr. Korchynsky.
Okay. Right.
Quite frankly, in garrison, when we're not deployed, it's fairly busy. I would treat very similar things that I treat in veterans now: depression, anxiety, PTSD. When you're a military psychologist, you have to be somewhat of a generalist and a jack of all trades, especially if you're assigned to combat units like I often was, because you may be the only provider. So the difference is, though, and people always think that when I deployed, I must have been busy all the time, but I wasn't, because in a combat zone, a lot of PTSD symptoms are functional and people are busy doing their jobs. So I saw a handful of patients a week, and it was usually somebody who got a Dear John letter or was having troubles with their child's behavior at home. It was not usually about their PTSD. And I screened literally every single soldier in our brigade before we deployed to Iraq for mental health issues, and recommended that we leave about 40 home due to mental health issues. That decision is up to the command. They agreed with most of them. But the ones who had combat related PTSD, they really wanted to go. They would feel bad about not going. And so they would often make deals about I'll go see Dr. Doherty, or Captain Doherty at that time. I'll go see Captain Doherty every week if you want me to, if you just let me deploy. So it's a little bit of a different environment because I don't actually have a control or authority. Even if I know someone has been horribly traumatized, I can make a recommendation and that's about it. I don't actually have the decision-making power, which is, kind of part of what's being talked about and has been talked about for the last 10 years or so with commanders having investigative authority over things like this.
Did you find a lot of the soldiers would avoid you because they were afraid of promotions, getting a stigma around them?
I'm sure that there were plenty who did. It did help when Defense Secretary Gates made the rule about security clearances that if you had a combat or a military related trauma, it could not be considered as a sole determining factor in whether you got denied a security clearance. So I think that helps some, but it really depends on the unit. Every unit is different and it starts at the top. If your brigade commander is supportive of behavioral health, like my last unit, Colonel now General Twitty was very supportive of me and the work I was doing and always encouraged people to come. When people lower down the chain of command would see that, it made them more likely to come see me. And, I was seeing sergeant majors in Iraq and, various, fairly high ranking people you don't normally see because that was an expectation from the top. If you have a problem, you will go deal with it.
What did that mean to you?
That was really important because I know very well that there was a stigma and every day we try and fight that. And we often enlist the chaplains to help us because there are chaplains in every battalion and they're seen as a safer option for speaking to because they don't have the same documentation requirements, quite frankly. They still do have to report to me if there was somebody that was suicidal or homicidal or something like that. But otherwise, anything else anyone said to the chaplain would be under lock and key. But it was really important that we worked well together because the chaplains would often be the ones to convince people to come and see me for more intensive treatment. Mm-hmm.
I want to share a picture that we have that you sent me a couple quick ones today.
Yep.
Some fun ones here. Hold on one second. This is great. Here we are.
Oh yeah. That is, if anyone here has been to NTC, that is a National Training Center in Fort Irwin. So even though we were stationed in Fort Bliss in a big desert, we still had to go to NTC to train for deployment. And the OPFOR, the opposing force, decided that I should be dead. So I had to go sit in a tent for 6 hours and play cards while they pretended I was dead.
Question about this. You, at what, how, this might be, faux pas, but how old were you when you were deployed?
Oh, that's fine. Okay. Let me see. So 2006. So I was, what was I? 74. Yeah. Well, I'm 46 now. And so that, that was 14 years ago. So I was, 31.
Okay.
31. Mm-hmm.
What got you into this line of work? If I can take a step back and just sort of hear like, okay, you got there, you went through, but why did you decide on this?
Mm-hmm. Well, psychology in general, I avoided in college for a long time. My boss was the director of summer of orientation. He happened to be the chief of the psychology department, and he kept bothering me. Once I realized anthropology was a hobby and I didn't want to dig in dirt for the rest of my life, I just said, I'll give it a try. So that's how I became a psychologist. But my interest in trauma started because of that OJT and on the job training. I just learned I had a knack for it and I understood it. And to me, it's very rewarding. The change that you can see in people is amazing.
I was gonna say, if I could interrupt just this, what you just said is I had a knack for it. And I don't know if I could ever do this type of work because I don't know if I have a knack for it. I don't think I do, but it's very different talking with people about their stories and listening to trauma and help guide someone through that trauma. So can you describe to me sort of what that knack is?
Sure.
Yeah.
Absolutely. And I will say that, I do see military sexual trauma survivors who for some reason can't or shouldn't see Dr. Korchynsky. Right now, what I see is mostly childhood sexual abuse survivors. So that can be even more difficult, but I don't internalize it. When Dr. Korchynsky was referencing earlier, that's, some people just don't take to this work. It's because they don't have the ability to separate themselves from the trauma that they're hearing. But similar to her, I feel like, I'm here to hear your stories and to validate your story. And to me, that's very meaningful to have somebody non-judgmentally listen to them and hear what they're saying. And especially in working with veterans, I always knew if I left the military, I would work at the VA. I get the military side of it. I understand why people don't report. I understand what it's like when people do, because I have lived through seeing that.
Thank you.
Mm-hmm.
And Dr. Korchynsky, I do want to offer some time here for you to talk about sort of what the VA is doing and how the VA is sort of tackling this problem.
Yeah. So one of the reasons I'm so proud to work at the VA is that we are a healthcare system, a national healthcare system that offers free mental health and medical services to veterans who've experienced military sexual trauma. Now, there's no list of what is covered and what's not. So how is this decided? This was very intentionally left very broadly. This is a decision between a veteran and their doctor. And the VA does not require any paperwork, doesn't require a diagnosis, doesn't require service-connected status. It is enough for a veteran to come in and say, yes, this happened to me. These are the problems I'm having, and we will provide free medical and mental health services for those conditions. And that is the only thing within VA that is offered free of charge. And completely understandable. When individuals sign up for the military, they know they could be putting themselves in harm's way at some point. Nobody signs up with the expectation that they will be harassed or sexually assaulted during their military service time. So that's, I think, the biggest thing that we offer is free care. On the mental health side, when I started at the VA, and I really was the lone psychologist who was treating post-traumatic stress disorder due to military sexual trauma. Now, we have so many psychologists and trainees who want to do this work. And I think part of the reason we have so many providers who want to do this work is because we have treatments now that we didn't have 30 years ago, 40 years ago after Vietnam. We have evidence-based psychotherapies that do not keep people tethered to the VA for life. We have their time-limited treatments, 4 months, 3 months in duration. They're very focused, they're very targeted, and they're designed to help people identify where they got stuck in their trauma, how to get them unstuck, and how to get them back into their lives and to have the lives that they want. And we used to think that there was no recovery from PTSD. That's really that was not that many decades ago. But we think very differently about PTSD now. And again, I think that's why that makes this work, as Dr. Doherty said, so rewarding, that people recover. People can have these kind of like light bulb moments when they realize, wait a minute, this wasn't my fault. And really can start moving forward in their recovery. So we have treatments that are very effective. They are designed to help people recover and get back into their lives. It's humbling to see the work that people do. It's not easy work, but folks that really do the heavy lifting, I think, really see the reward on the other side.
How can a veteran access MST-related care?
It's a phone call. So there is somebody in my position at every single VA across the country. And VA wanted to remove any and all barriers. So we got to the level of training all VA medical centers, trained their telephone operators at the main switchboard number at any hospital. If you call up and say, I'd like to speak to the MST coordinator, I'd like to speak to the military sexual trauma coordinator, the telephone operators have been trained to direct your call to the MST coordinator at that facility. So it's pretty simple. You do have to be registered at the VA that you want to seek treatment. And that's a pretty easy process to do. You need a DD-214. I think it's easiest to show up in person. You can do it over the phone. It's a little bit more cumbersome, but it's easy just to show up at our registration desk or at any registration desk at any VA and get registered and get
Does a veteran have to be service connected or have a particular diagnosis?
No, absolutely not. No, you don't need anything. You don't need a diagnosis, a service connection, a police report. You don't need anything. You come in and it is, again, between you and that provider, whether it's a mental health provider or a medical provider, to determine whether you're seeking treatment for something that's MST related. Again, the umbrella was intentionally left very, very broadly. So it doesn't just have to be PTSD. Maybe you developed a substance use disorder as a result of your trauma, which is very, very common. And that's what you're seeking treatment for, the substance use. Maybe you are coming in to address the PTSD or coming in to address the depression. But it, again, was left very, very broadly, very intentionally.
I also think it's important that there is that military sexual trauma coordinator at every site, because it's not unusual for there to be staff turnover and registration and enrollment who aren't always familiar with the rules and may say, oh, look at a chart, be like, oh, well, this veteran they're not eligible for care. And any one of us providers anywhere in the hospital can call on the military sexual trauma coordinator and say, hey, I've got this veteran. I really think that they qualify, but I keep getting pushback saying, no, they're not. And because people like Dr. Korchynsky know those rules inside and out, they can easily intervene and kind of re-educate or educate the newer staff to say, actually, yes, this person is eligible, and here's why.
What would you recommend in that particular instance for the veteran to do? They might feel a little lost walking in and frustrated by that.
Well, I've had veterans just cold call me. I've had veterans just that are not in our system. Maybe they got my name from a veteran service organization. It doesn't even matter how they got my name. And they'll call me and I will walk them through the process of how to get registered. And I know I'm not unique in this. Any MST coordinator, any facility will do it.
Yeah. When I've run across cases like that, I just tell them, I said, we will fix this. This will be fixed. You will be fine. You will get your care. And then we get it fixed.
Dr. Doherty, being a veteran yourself, do you feel closer to this particular trauma that you want to, in the sense that, you being a part of the military, as opposed to Dr. Korchynsky, is it feel more personal to you, I guess is what I'm trying to ask?
To some extent, I think in that it is much easier for me to build a rapport with veterans that come in. It's not uncommon for veterans to use as an avoidance technique to say, I can only speak to a veteran because they're the only ones who understand me. We try and discourage that because we recognize it as part of the avoidance. But if they're quite insistent, we'd rather them get treatment and just see me than deny them that care. One thing that I frequently talk about, I'm also our facilities mental health summit coordinator, so often speak at those events, is part of the problem, I think, with coming out is that this kind of idea that everyone who served is a hero. And I have a real problem with that because of what I have seen and experienced in the military. And there are plenty of heroes out there, don't trust me. But the military is a microcosm of society. And there are bad people in the military, just like there are bad people out in the world who do terrible things. So I think for victims of sexual trauma, they also get that message, well, everyone sees these people as heroes. And it invalidates and devalues their experience even more because they get back to, is something wrong with me? What did I do to cause this? How is this my fault? And, and I could talk certainly about what it's like when you're in the military and you try and report something like this.
And Dr. Doherty, is the ratio of like sexual assault and harassment in the military in relation to the larger culture? Is that something that, myself as a non-veteran, should I be aware of?
I think so. Dr. Korchynsky certainly has the rates. I don't have the numbers in front of me comparing to what the civilian world is, but even, just off the top of my head, there's an estimate that at least for women, one in every 4 women has likely been sexually assaulted. So in the military, it's 1 in 3. So that actually, that incidence is higher. We could speculate about the varying reasons for that. People living in close quarters. There's people going to the military just like that, sometimes go into law enforcement who do it for the power issue. Because I'd like to emphasize, sexual assault's not about sex. It's about power and control. And people tend to forget about that. What often happens is if somebody senior assaulting somebody junior.
And Dr. Korchynsky and I were talking a bit about this prior to starting the program tonight, is that the Army has a rule that says that enlistees cannot give consent due to that power differential.
Yes, that's fairly recent. And it's interesting because there's this ongoing discussion, in Congress and in the media and, just in public in general about the role of commanders in investigating sexual assault. And from my perspective, having been in the military and dealt with victims, as well as I've had to evaluate perpetrators for their defense attorneys, sexual assault is a crime. And it is a crime whether you're in the military or whether you are not. It is different than a UCMJ crime. So the Uniform Code of Military Justice puts more restrictions on us as military members than the civilians have. So for example, desertion is a great example. You could walk off your civilian job any day. Nobody's sending the cops after you to chase you down. But that
you don't know Todd DiPastino.
Okay, Todd might chase you down. Maybe that's just because he really likes you so much and wants you back. But in the military, that is a crime according to UCMJ.
Mm-hmm.
I personally don't think sexual assault should be treated the same way as desertion, because sexual assault is a crime whether you're in the military or whether you're not. And in talking to the company level commanders that I've worked with that are often tasked with this, they struggle with this. They know they're not criminal investigators. Many of them don't like being put in this position because it's a conflict of interest, because it often happens within the one unit. So they have to deal with the potential victim and the potential perpetrator. And they're kind of stuck in the middle of that and being told, hey, you need to investigate this and figure that out. That's not a good system.
What do you propose would be a good fix? Do you think, make it all third party, civilian investigators?
We have criminal investigative division for a reason. We have CID. I've known plenty of other crimes that commanders didn't get involved in that CID investigated. Or if it was turned outside to civilian investigators who specialized in these types of crimes. I just think that, and I understand that in the military, things can change slowly, but they can also change really fast if there is a will to change them. This is one of those things I think that has been so politically laden and people are so uncomfortable talking about.
Mm-hmm.
I think that has partly led to the slowness in the change. Because if we really want what's best for the service members, and again, let's not forget, plenty of men are assaulted. Numerically, it's probably more men, just because there's so many more men in the military, even though the rate is higher for women. And we often talk about this as just a woman issue, and it's not just a woman issue. It's a human issue and it's a crime that should be investigated as such.
It makes me think of the idea of myths surrounding MST, these myths of
Yes.
It's only a female problem. And speaking to one of those, and Dr. Korchynsky, we talked about this on the podcast, was this idea of fake reports. And I recently read an article that a clinical psychologist in I think it was the Army, who said, I've never seen one. I'm sure that they probably exist, but they are in such small numbers that it's almost a myth, this idea of fake reports.
Yeah, and I think that does such a disservice. I think that unfortunately may kind of drive victims even further underground. And when I have talked to patients over the years, and we talk about why they didn't report, and a common theme is, I didn't think I was going to be believed.
Absolutely.
And so I think this idea of fake reporting, I think is so harmful.
I saw one, and it was so easy to tell. And this person was very mentally ill, and the unit got her the treatment. She wound up having to be discharged because even a glimpse past the surface level, it was quite clear that it was not true, because the person she was accusing wasn't even anywhere in the state at the time. But it was because of that person's own mental health issues. It wasn't what people tend to think of. It's somebody trying to get revenge or a jilted lover. No, those things I never, ever saw anything like that.
Dr. Doherty, with how things have been shifting quickly, as you were just saying, over the past year because of the Vanessa Guillen murder, is it something that you're heartened by, that you see that the wheels are turning, that more people are becoming aware of this problem, that it's it's hitting the headlines more, it's creating Congress to act, things like that?
Yeah, it's heartening, but it's also upsetting that it took something like Vanessa Guillen's death to get things moving on this again. For someone to have to be murdered for this to bring up, because these are the people that Dr. Korchynsky and I see every day. And don't get me wrong, I loved being in the military, but it is not perfect. And there are a lot of things about the way that the military trains us, as Dr. Korchynsky talked a little about earlier, that makes it much more difficult for victims to deal with and manage their trauma and recover from it.
And I just want to say, well, there are certainly things that we can point at and say, well, this is definitely progress, because it was not that long ago, if a victim had to report an assault up her chain of command, she was often reporting to the perpetrator. That was not all that long ago. Mm-hmm. So that is changing, and we can be really happy that that's changing. But let's not lose sight of the fact that the actual conviction rates are abysmally low in the military. They're low in the civilian world too, but they're extremely low in the military. And I think that's important just to keep our eye on, because I think that is a reflection of how serious we take this problem.
And I think it's almost cyclical. It seems historic wise that we take this problem seriously, and then it sort of fades a bit. And I want to get back to that thought just in a second. But Rick from Facebook asked, does one have to be registered with the VA in order to receive your services?
Yes, you do have to be registered at the VA. There's no way for us to schedule appointments unless you are registered in our system.
Could that person then also just go to the vet center if they just need to talk to somebody?
Oh, thank you for bringing that up. We love our vet center partners. Absolutely. Vet centers are also ideal places if an individual does not want to come to the VA, and that is certainly their prerogative. They can go to the vet center. Vet centers have readjustment counselors who are specifically trained in military sexual trauma. So if that is more comfortable for an individual to go to a vet center, that's a great option also.
Okay, so back to this idea of like a historical, cyclical nature of us being aware of this. You mentioned a couple of things, Dr. Korchynsky, and please remind me, please shock my memory. At the beginning of our podcast, you talked about two particular historic events. I believe one was called Tailhook.
Yeah.
And I'm wondering if you could give us some historical context of what that was. And there was a second one that I'd love to hear about as well.
Yeah. So those are really the two events that I think put military sexual trauma on the map for all of us. And the Tailhook Association is an association of retired aviators, and they had an annual convention called the Tailhook Convention. And back in the early 90s, it made the news because a large number of women and some men came forward and said that they were sexually assaulted at this convention. And as they dug deeper into the story, they found that this was not a one-off. This was not just this one particular convention, that this happened regularly at these annual conventions. And then in the mid 90s, I think it was the scandal at the Aberdeen Proving Grounds, where a number of drill instructors were charged with sexually assaulting recruits. And so these were just sensational stories that made the news. And this is really what spurred Congress to get involved and to act. And one of the interesting things when we look at the timeline of military sexual trauma in the VA, we are mandated by Congress to screen veterans and to report to Congress the data. But the initial guidance from Congress, the mandate actually, was to offer outreach and counseling service to women veterans who've experienced military sexual trauma. It literally took Congress 2 years to expand that directive to say, oh, by the way, offer it to men too. Offer these free services to men too in the outreach. And I think that reflects, this kind of broader rape myth in our society that rape was just a woman's problem. And it really took society as a whole and Congress a couple of years to kind of catch up and realize that men also experience sexual assault in the military. And I've been at the VA 20 years, and I recall one of my earliest experiences was interviewing a World War II era veteran who reported military sexual trauma. So this is not a new problem, but this is kind of the context in which it came to light at the VA. And I think we've evolved very rapidly as a result, and are continuing to evolve on this front.
Obviously, we can't go into detail of that veteran's experience or the report, but that's this was the first time that veteran had reported the trauma, the event, since World War II.
I don't know if he had previously reported. It was the first time, and again, this was a long time ago. I'm not remembering the circumstances that brought him to me, but yeah, that was one of the earliest times he told a provider that this had happened to him.
Wow. Thank you both for this, and please continue on with the conversation here. I also want to open up the floor here to Megan Ayers. Megan, I really appreciate you coming on the program tonight.
Thank you for having me.
Of course, you, as we learned, you are Navy veteran, correct?
Yes, correct.
And we had some fun talking about your family before we started the program tonight, because month of the military brat, though not necessarily a military brat yourself, you come from a very extensive military family.
A huge military family.
Yeah,
Huge.
You said that it was easier to list those who were not in the military as opposed to everyone. The people in your family who were not in the military, did they ever get good ribbing from the rest of the family of like, oh, you went into, law or whatever else that was not military?
No, there wasn't too much of that, but it definitely military was above all.
And you were the only Navy veteran.
Yes, I am the only Navy veteran.
Todd asked you right before the program was, why did you choose Navy?
They were offering me job opportunities in my junior year of high school.
Was there one that in particular that really stuck out to you that you were like, Navy's it for me?
They were, it was 1978. They were beginning to open up fields to women. And I became an aircraft mechanic. And I was extremely excited about that. Father was on B-17s, brother was on B-52s. This was it. And in fact, when I was in, because I had high enough scores, I was able to go for aircrew candidate school, which they had just opened up to women. I was number 6 to actually complete it. Unfortunately, the night before school, one of my instructors and some of my fellow students decided to give me a MST event. And I didn't remember that till I worked with Dr. Korchynsky. And that was quite a bit. It's been obviously 1978, 79, and this is the 2021. So it's been quite some time. I didn't remember it, but I did pass that school and graduate and become an air crewman. And I think that was my body's protection mechanism. How could I have completed the school beside my perpetrators if I remembered? I don't think I could have done it.
So you're saying that you graduating and going on that there's no recollection of that time?
I have a recollection of the school. The night that the incident happened before class, what I do remember is a knock at the door. There's my instructor. He pushes me back in the room. I hear the laughter of some of my classmates. And then it kind of fades out.
When did you get out of the Navy?
I only stayed in for 3.5 years because I had been raped actually in the Navy before that. And when I was in A school, and then I was raped once after that. I got out at 3.5 years because my mental health was disintegrating and I didn't really understand why. I only remembered one rape, and strange as it may sound, I kept telling myself, no, I know rape ruins some people's lives and it's very harsh, but that didn't affect me. No, that did not affect me. And I just went on as far as I could till I absolutely fell over.
It sounds a lot like what we talked about with Timothy on the podcast, just this idea of powering through the trauma, doing what you have to do. Yeah. And, I was watching you throughout the program tonight, just seeing you shake your head and to some of the terms and things that Dr. Korchynsky and Dr. Doherty were talking about, this idea of the shame, guilt, or self-blame that you work through for not reporting. How long did it take you to report this?
I never reported it to the military. I can remember the minute that the event was over on the first rape, first thing in my head was, nobody can know about this. Nobody can know this happened. I can't tell a soul. I didn't tell my family, parents, brothers, sisters, anyone, probably a good 10 years. And then I shared with a significant other, but still, I just didn't talk about it. And I always firmly believed that, no, that happened to me, but it did not affect me. And I went on to become a FAA aircraft mechanic and worked for several airlines. And what I didn't realize is I was in the same cycle over and over again, where I would white knuckle it and work as long as I could till I absolutely fell over. Till I went to the VA in South Carolina, they dug a little deeper and asked some more questions, and they suggested, this may be PTSD. And then I said, well, I was raped. And they started putting it all together for me.
I referenced Timothy on the podcast because of a lot of what you're saying is sort of mirroring that, but he had family who pretty much, he said, dragged him into the VA. Was there a point where the VA was where you put your focus on? I'm going to walk in there. What led to that very big step?
Well, I was having trouble holding a job, and so I started contracting, which is very easy for an aircraft mechanic. But the length of time I could hold the job was getting less and less, and it was starting to be punctuated with suicide attempts in between. And as a contractor, I had no insurance. So I went to the VA to see, if I could take advantage of medical care. And at first it started, I paid my copay and everything, until, like I said, they started talking to me and putting things together.
Mm-hmm. Talk a bit about how the process of working through the VA, working through the trauma, as we said earlier, that it's a daily thing. And you've obviously got to a point, we're going to talk about the walk that you have planned coming up in a couple of weeks, or in a week and a half, actually. And that's very, very proactive of you. So I'm intrigued as to this journey that you took from entering the VA to kind of taking the bull by the horns here and saying, I want everybody to know about this, and there should be general knowledge about this.
Well, I was lucky enough to have Dr. Korchynsky as my provider. And some of the gifts she gave me were, I now call the perpetrators criminals. And that was a crime. They were wrong. It was not my fault. Those were huge steps. And you can't believe how much that brings you up, how much that lifts off of you when you finally say, no, it wasn't my fault. No, that was a criminal. That's a felony.
Mm-hmm. And when did you first enter the VA for that initial conversation?
Let's see. I'm thinking I first started going to the VA pre-2010, and I actually went for a while. I just thought I had mental issues. I did not, like I said, I didn't connect it to the rape. I was like, no, I am fine. That did not bother me.
Wow. And I guess what led you to create the Our Sister's Keeper movement? What was where did that begin?
Actually, I joined it from here. I am a member of that.
Mhm.
It's a nationwide organization. Last year, we had a rally downtown in Pittsburgh, and every event we have, there are events all over the country to match it. Like this one, the 24th, the OKSM, our Sisters Keepers movement, will have candlelight vigils and walks in memory of survivors and non-survivors of military sexual trauma. But we're inviting everyone to join us, all sexual trauma survivors.
That's incredible. And what are the logistics here? Where are you starting? Where are you finishing? How many, obviously during COVID, this is a difficult time to get a big group together, but what are the details?
We will be doing social distancing. We're going to start across the street from the VA in front of the little school there.
Mhm.
And we're going to walk all downhill. Yes, I picked that specifically. All
Smart in
downhill.
Pittsburgh. That's so smart in Pittsburgh. Just let me say that.
I was like, nobody's going to walk uphill. But to the Soldier Sailors Memorial Hall. And then we'll have possibly 1-2 speakers there and disband. We're hoping to get a good turnout for this. Some of the universities, veterans departments have banded with us. We're co-partnered with No More, which is a civilian group,
Mhm.
Rise, which is a Pittsburgh local veterans group.
Right.
So if anybody can come out, or even bring your dog, we need bodies.
Definitely. And it's really important to bring attention to this. Dr. Korchynsky,
Yeah, so I want to just reflect on something Ms. Ayers said, because I think it's so powerful. And I talked about the barrier and the burden of shame and guilt. And one of the reasons that, or one of the consequences of the shame and guilt is secrecy. We keep the trauma from our family, our friends, our doctors, ourselves. And that the secrecy, unfortunately, just kind of keeps the whole thing festering. And I think that when people realize that the trauma was not their fault, they are not permanently broken, they can reclaim their lives. They are less compelled to keep it a secret. And when I work with folks who kind of come in, they spontaneously share that, oh, I finally disclosed this to my mother, or I did finally disclose this to my family, or as Ms. Ayers, to take it in a very public way. And what that reflects is like, I'm not carrying this shame anymore because I didn't do anything. And just because I was victimized once doesn't mean that I will be victimized for the rest of my life. And so I always look at these, whether you share with a family member or do something in a more public way, I always take that as that is another step in one's recovery, because you no longer feel the need or feel compelled to keep this a secret, that this was something that you did wrong. So I applaud you, Ms. Ferris, for what you're doing, and I applaud your ongoing recovery.
Well, you definitely have a small walk on water syndrome for me.
Well, I heard that suck it up and drive on, Megan. I heard that throughout your story was suck it up and drive on. And that doesn't work. But
No,
that's what we're taught works. But you know what? We only got so much space to suck it up, you know, and you saw that, and that you explained that very elegantly, that you did that and you tried it and you worked that. And at some point we just can't contain that anymore.
No, it catches up to you, and it starts affecting family and other people, you know. Right before I was made service connected for this, my daughters had to go looking for me, and get the police to open up my house and look for me. They didn't know what had happened. They found me in a emergency room where I had attempted suicide. And that kills me that I put my children through that.
There's a question here in the chat from Carol Popchak. Is there any indication from case study and or personal experiences that assaults on women in the military in particular is coming from male colleagues who don't want women in their ranks?
I know from my experience, it definitely was. I completely remember constantly hearing, no, dumb, the B word is going to sleep their way through my Navy. And that was, but I don't know about now. I don't know if it's quite the same.
Dr. Doherty, you were muted. Sorry.
Oops, sorry. I don't know that there are any actual studies looking at why the perpetrators actually perpetrated the crime, but anecdotally, Megan, I've heard similar stories to yours from older women veterans, not as much from younger women veterans. At least it wasn't outright said, I'm doing this because you're a chick in my army or anything like that.
Mm-hmm.
So, but that would be an interesting study if it could be done.
And a comment here in the chat from SL George. Would like a comment on the following, please. It is dismaying that there is such a resistance to telling women not to let their guard down and get drunk in front of a bunch of men, i.e. in a military or college situation. Most men in a given group will be good guys, but there is a possibility that one or two or more will not be. It's not easy to see this, especially when one is young, trusting, and naive. It's not about blaming the victim. It's about preventing women from becoming a victim, which should be of the utmost priority.
I always tell women that I work with in recovery, I always want you to take reasonable safety precautions without going overboard. Not every man is a perpetrator. Not everybody who gets drunk is assaulted. So I want you to take reasonable safety precautions. And I also, when I'm working with folks and we're talking about the age of when a trauma occurred, and again, if we're kind of thinking about a typical situation where maybe a woman 18, 19, or 20, they may be using alcohol, they may have been intoxicated, maybe a sexual assault happened. But when we think about it, and when I talk to women and I ask them to go back to that moment, what were you doing and why were you doing it? And it oftentimes comes down to they were doing kind of age appropriate things with people that they thought they could trust, because that is that's part of the indoctrination.
Absolutely.
And so they really weren't doing anything wrong. And it is, we call that as psychologists, when 30 years later, when a person says, well, I shouldn't have been drunk, we call that hindsight bias. You're looking back at a decision 30 years ago with all the knowledge and wisdom and experience and knowing how that situation turned out that you didn't have back then. We always want people to take reasonable safety precautions without going overboard. And also, I think understanding, I think it's helpful for individuals who've had that experience to keep in mind the context. How old were they? What was their intention when they went to that party? It certainly wasn't to get raped.
Right.
I completely agree with that. And I when my daughter is old enough, I will tell her to take sensible precautions, just like I do the veterans I work with today, no matter how old or young they are. Yet I can still feel resentful that I have to do that because the perpetrator is at fault. As I was a young college student once. I was in the military. I've done my share of drinking and going out with the guys. And could that have been a risk? Sure. Mm-hmm. It clearly doesn't mean that I would have deserved to be assaulted, nor does anybody. And that's something that a lot of women are struggling with is why do I need to worry about this? Why do I need to, but you're right. It is a fact of life that we do need to worry about it. And we should take reasonable precautions, as should anybody, because most of the men I've worked with got assaulted in the very same situations that those women did.
it doesn't always protect you to stay sober.
That's right.
I was stone cold sober for all three. They came to my barracks door, knocked. You're gonna answer your door. In Italy, I was living in a house off base. They came to the door and they knocked. I answered my door. The first one, I was on a date with someone that I had been going out with for a while. You know, no drinking.
Megan, the last couple episodes of Generation 9/11, I think that one of the themes has been trust, that I keep hearing brought up over and over again. And I'm interested in to hear your take on trust and how you attempt to reestablish that piece of your life after this.
I think a lot of my growth in trust has occurred recently, that I have begun sharing my story in a more public manner, that people aren't going, smirking and making comments. They aren't saying she asked for it. They don't ask me, what was I wearing? They actually listen to me and have compassion. I guess my mindset was so locked in. I'm still absolutely shocked, especially with males, when I tell them what happened and they're compassionate. It blows me away. The fear was in my mind. I don't know how much of it was real.
And Dr. Korchynsky and Dr. Doherty, someone comes into your office and you know immediately that the trust is going to be a difficult thing for you to establish in that room, and it has to be established immediately. How do you do that?
You don't do it immediately. That is really the answer.
And I'll often acknowledge that because it's doesn't take a long time to learn that maybe the assault happened years ago or decades ago, and they've spent decades avoiding it. And so taking that first step is extremely hard. Mm-hmm. And I acknowledge that this is really hard, but I'm glad you're here. And I lay out what the treatment would look like, because I believe people should be informed consumers, and say, are you willing to try this? Because what you've been doing doesn't seem like it's working anymore. Are you willing to try something different? Mm-hmm.
Yeah, I agree. And I also tell them, I understand that you don't trust me right now, and that you may not have a lot of faith that this is going to work. But the fact that you came in here today means you're ready to try something different. And I'm not here to judge you. I'm not here to force you to do anything. But like Dr. Korchynsky said, are you willing to try this? And let's just see how it goes. And you don't have to tell me everything right now. I know you just met me. You don't know me from Adam. You don't have to tell me every little thing right now. You can ask me what you like. We'll get there, on your time, and we'll keep reassessing as we go along.
The next question I want to ask is much more difficult one. Not an easy answer to this one, but it talks. Is the military a toxic culture, and is there something about that culture that either encourages or promotes or invites sexual assault?
Yes, I believe. I don't believe it's limited to the military, because, as I said, when I got out of the service, I was an aircraft mechanic for my entire life. It's the thing I noticed about working with men all the time. They would seem to look around for the weakest one, male or female, in their group and attack them. It was some sort of a pecking order thing, or, I'm cooler than you. And I think with females, I think it's just an easy target. Easier to look better than the female. It is toxic. When I suffered harassment in the service, but when I got out and I worked for the airlines all those years, bending over to work on avionics and having someone grab my belt loops and bang me from behind was an average occurrence. And they just thought they were so funny.
I don't think that the military as a whole is necessarily a toxic culture. I think a lot depends on the individual unit climate. However, I think that professions like the military and law enforcement, more aggressive professions that tend to be dominated by men, they laud predatory characteristics, and predators tend to do well in those settings and in those professions, because everyone thinks that the person that's going to be committing the rape, is going to be, crap soldier Joe Snuffy who shouldn't be here in the first place. But that's not usually how it happens. And people are like, how could somebody be accusing this great troop of doing something this horrible? Because exactly what makes them a predator makes them succeed in other areas of the military and law enforcement and places like that. And then there's the cohesion issue, where we're taught we're supposed to have each other's backs. Our little unit here, you see it even in the mandatory fun days we're made to do as units, and you're supposed to be able to rely on this person to save your life. So when something like that is done to you by another military member, especially one of your unit, that totally destroys any trust. The betrayal is so huge. And I think that's one of the great difficulties that we have with people trying to recover from military sexual trauma is I was told these things, and that was completely a lie for that person in that situation.
And I would also add that the military, one of the things that stands out to me is that it is very easy for perpetrators to hide out in the military. It's kind of like the Catholic Church. They
get moved.
They get moved. It's very easy for them to hide out. And as Dr. Doherty was saying, it's not something that unit commanders want to deal with. So, it's not like, and it's not even, in talking to patients that I've seen, if they do disclose to a fellow service member, I'm always struck by how often they are not supported by their fellow service member, because now you've created this kind of stain on the unit. Conflict and stain on the unit. And so again, it's just so easy for perpetrators to hide out and go undetected. We know that there's like scant reporting in the military. And so it's kind of like almost I hate to say it, a perfect environment for perpetrators to kind of hide out.
Yeah. People are afraid to report even now. And I served in the time that spanned both having to report any incident of assault immediately to the MPs and CID, to when that changed and service members were allowed to have restricted reporting where they could tell a medical provider and we would not have to report it. So I've worked in both of those areas, but there's still a legitimate fear. If I tell anybody, bad things are going to happen to me in my career. And the military is a small place. I don't care what anyone says about confidentiality. It's like a game of telephone. Once someone tells, it gets out somehow. It gets out and people find out, and they unfortunately often start treating the victim, just like Dr. Korchynsky said, as ooh, you made this accusation. People might shun them. What will you say about me? Look at all the conflict this is causing in the unit. And then you may still have these people that being forced to continue to work together while an investigation is going on. It's a horrible environment. It's no wonder that people have become so terribly traumatized by it.
The excellent example is the NCO that he just pleaded guilty to 2 rapes and a list of other charges. And he had raped a woman at one base. She brought charges. She went straight to the hospital, did everything right. They told her, you did this right. This is great. Well, a letter of, disapproval was put in his record. Counseling, thank you. And then he was sent to the next base. Unfortunately, he raped another woman at the next base. And that's when they finally decided, oh, well, I guess we better bring this to trial.
And what is interesting is this sense of other. Because, and this is anecdotal, but it would be interesting to compare. And again, we don't have statistics necessarily on the number of civilians who assault military service members, but I remember distinctly in Iraq, one of our female soldiers was raped. She was actually Iraqi by birth, and she was raped by one of our, we call them Iraqi interpreters that was working for us. And she did everything right. The guy took off. He took off. He realized she was telling people, and her unit sent out hunter-killer teams looking for this person to avenge her, essentially, because he was other. He's not one of us. And it's just so striking, that difference in, and I don't know how they would have reacted if she had had that, but just thinking of how people react when it happens within a unit compared to that instance where look what happens when someone outside does this to one of our own. And that can really create this real kind of confusion in people, understandably.
It sounds like when siblings fight, siblings will kill each other, but let someone else attack them, and they're a united front.
Yep.
Very true. This is certainly not the final word on MST. And again, I'm hopeful that you all would join us again to continue this conversation. But I want to give you the floor, Dr. Korchynsky, Dr. Doherty, Megan, just the idea of what would you say to someone who might be considering coming forward to report this? What advice would you give to someone now?
Please do. Please do. I'll be honest. Sorry, Dr. Korchynsky, I'd probably hand out your number.
There's those ghost calls. That's where they're coming from.
It's the difference between having a life and not having a life.
That's very well said. And so again, Dr. Doherty now and I are on the veteran side. And so, and I know certainly from personal experience that people can try to carry this burden for years and decades before they seek treatment. And so I would encourage, it doesn't matter if it happened a year ago or 30 years ago, there is help available. And there's certainly, I mean, as humbled as I am to work with veterans, I'm also humbled to work with a fabulous group of colleagues like Dr. Doherty. And we have colleagues here who are very experienced, very well-trained, very compassionate, who want to help you on your journey to reclaim your life.
I would agree with everything you said. And I actually looked at that question from a slightly different angle, because we do work with active duty and ongoing Guard and reservists. If someone came into me and wanted to work on this in treatment and asked if I thought they should report it through their chain of command, I certainly would not tell them what to do. And I would be honest with them, and I would, help them work through, what's your command climate like? Do you feel like you can trust that this will not harm you, that this will actually be helpful for you? Because we're not there to do something that's going to further traumatize them, and they know best what their unit is like. So because we want them to come to us for treatment, whether they decide to go down a legal avenue or not. And I want them to understand, you don't have to do anything you don't want to do.
Boy, in considering this conversation tonight, I was like telling my wife earlier, I'm like, oh boy, I don't know if I can do this tonight. Just want to be open and available and ask the right questions and make sure that we're getting out the word. And it's a hard subject. It's not something I think everybody wakes up in the morning and says, I want to talk about MST tonight. But having the three of you talk tonight has been very educational, and I appreciate so much you guiding us through this discussion. I agree with everything that you've said. Just, I hope that somebody reaches out to either of you, Dr. Doherty, Dr. Korchynsky, to take that advice from Megan. It's, I think having a guide is certainly going to make the work a lot easier. Todd, I always like to pop to you here at the end, just to hear some wise words.
I'm with you. I mean, I've spent my career with the Veterans Breakfast Club being humbled by the stories, and tonight was no exception, but in a kind of a slightly different way. I wrote my notes, the word betrayal, 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 betrayal over and over and over again. I just think that that is such a central part of the experience of, because having worked with veterans for 13 years, I know that the military life can be very difficult, but the payoff is this community, this tight community, this camaraderie. And then when something like that happens to you, it's all betrayed. There's no redeeming, virtue to serving in the military. Bravery. I wrote that about a dozen times. Megan, I wondered what gave you the courage to come and be so candid with us. And you answered it without me having to ask that. And I just salute the courage. I'm humbled by your courage. You're amazing. You're amazing. And the deep intelligence and insight and eloquence of all of you about this subject that is much more difficult and even complicated than I had considered.
Mhm.
And I'm just so grateful, Dr. Doherty, Dr. Korchynsky, for you to lend your expertise and experience. And you are in the right line of work. And I'm glad we have you in that line of work, Boy, oh boy.
Certainly.
So thank you.
Thanks for having us.
Thanks for
course.
having us, Todd. And this has really been a wonderful evening. And Ms. Ayers, thank you for sharing. And I wish you well on your ongoing journey of recovery.
And please be sure to check out the Scuttlebutt coming up this Monday. It's going to be a 2-part conversation with Dr. Korchynsky, Timothy Jones, a survivor of MST, Ryan All, our veteran from the Army. We have a very interesting conversation touching on a lot of the highlights that we talked about tonight, but from the point of view of a veteran of color who dealt with it in the Navy as well. I appreciate everyone's ear tonight and for your attendance to talk about this subject. And if you wanted to reach out to either myself or Todd for comments on tonight's program, you can do that at Shaun, SHAUN, at veteransbreakfastclub.org, or Todd, easier to spell, at veteransbreakfastclub.org. Thank you all, and I hope that everyone has a wonderful evening.
Thank you very much.